So I've been treating TMJ, temporomandibular joint disorder, for about 20 years now. I've had some luck. Many doctors out there who are delivering TMJ care. Sometimes it can be frustrating because at times the patients don't respond in a way in which we think they will. Especially now, we focus on what we specialize in. You know, dentistry, we sort of like stop right at the neck and we say, oh, that's it. The rest isn't really my territory. But the truth is that you're treating the whole patient. And if you're going to be treating an entire patient and not just symptoms, you've really got to address what we call the root cause. And oftentimes patients' TMJs are something completely different than what's in their head and neck. Sometimes Dr. T can work on their neck or their shoulder or their back, and all of a sudden they get resolution along with the treatment that I provide with them as well. And so we're getting really great results, and we think we're doing something truly unique that hasn't been done before. So we're pairing dentistry, TMJ treatment, along with physical therapy and the care that it can offer.
The dental aspect versus the how does physical therapy tie into dental work? Think about hardware versus software. So you put something in your mouth like Invisalign, a tray, something that is working physically on your teeth. There's going to be underlying fixes that need to be done, primarily neuromuscular re-education that needs to be done in order for you to form or conform. You want to be able to conform to this hardware. And that's what neuromuscular re-education is. We work on re-educating muscles that may have not been working, that are now going to have to start to work because of physical changes that are going to occur over a long period of time. You have to wear Invisalign for how many months, Doc?
Average patient is 18 months.
So over a year and a half, there's going to be these minor changes, little things that keep occurring. And so there's several muscles that we need to address and learn how they function, make sure they're functioning, and that they're not compensating from another muscle.
So if you're already wearing some sort of an appliance or guard or an orthotic that a dentist may have made for you, I think that's a great step toward treating your TM joint dysfunction. But I'd also really like you to understand that part of the process and part of what's happening here might be full body. It might have something completely different to do than your head and neck, than your teeth. And that's really what we're trying to investigate here.
Physical therapy is working with dentistry at the Art of Dentistry. And we work as a team. So we take a look at your imaging, we take a look at each other's findings. We've had to actually learn how to speak each other's language. And so this isn't something that you can find anywhere where a dentist is starting to work with a physical therapist, but we truly believe that it's important. If you take a look at the anatomy, it's all very close. The jaw to the ear, to the inner ear. So you may have popping in your jaw causing dizziness, causing balance problems, causing neck pain, causing shoulder pain. So when we address a problem, we try to look at the root cause, like Dr. Berry said.
I think over the years I've seen a lot of patients for TMJ, TM joint disorder, whatever you want to call it, and they come in from all walks of life. And sometimes patients do come in and they are seeing a physical therapist or a chiropractor. And I applaud that because someone has already educated that patient into the importance of the full body. But the difference here is that Dr. T is in that room with me. So he's literally seeing what I'm providing for that patient. If it's an orthotic that's making a patient go in a different direction, or forcing the jaw joint to go in a different direction, or correcting something that I think would need correction in their bite, he's in that room with me. And he's able to say, okay, well, this is what happened here, so let me do some adjustments to these muscles so that it's going to be more effective, you're going to have a better result for probably a lot less time and probably a lot less money. I can't think of anything more holistic than putting the body back together where it was meant to be, instead of separating it from head and neck and the rest of the body, and doctors just talking on the phone about you. There's nothing that's more holistic or full body approach than you getting your care in one place by two doctors who have years of experience helping people just like you. And that's what we've done here at the Art of Dentistry.